How are you doing, man? How do you say your name?
The Discord name or my name?
Scalandra?
SCOLOPENDRA.
SCOLOPENDRA.
Yeah.
Okay, and what is your name if you feel comfortable sharing?
Dean.
Dean.
Yeah.
Okay, nice to meet you, Dean. So, how long ago did you do MSc?
Gosh, I think I must have started the process in 2021.
How'd you find out about it?
I found out about it. Just I was having so many issues, and it became clear that I was going to need some sort of braces. And I was going to orthodontics, who told me I was going to need to take 8 total teeth out, 4 on the upper, and I just disliked the concept of having to remove healthy teeth. So I found out about MSc through YouTube, and then it kind of just went up from there.
So on YouTube, who did you find?
I think it was Ron.
Ron?
Yeah.
So, how many turns did you do?
Total turns, I don't know, but it was 24 millimeters total. That's 2 maxed MSE type 2s.
Wow. So how much did it cost you? Did you have to pay for the initial MSc?
Yeah, I think it was an upcharge atop the initial MSc, but it wasn't a payment for 2 full MSCs.
So what was the greatest benefit you'd say that you got from the MSc? What was the initial benefit you saw or felt?
I think the greatest benefit is really just having a bite that seems like it's designed to fill my face. I feel like, I guess I've always had a wider than average soft tissue profile, and I felt like I had this really narrow smile that really didn't fit. And seeing sort of my bite and my face come together, I'm still in the midst of a process. I'm still going to need surgery for the mandible, but really sort of getting myself more, I guess, anatomically natural or ideal has been really nice.
What was the first cognitive enhancement that you felt?
I honestly can't attribute any cognitive enhancements to this, but it did give me the ability to nose breathe during physical exertion, and certainly for anyone, exercise is going to help with cognition quite a bit.
Have you seen any benefits? Let's say hair loss or prevention of hair loss. Has your hair become thicker, more dense? Maybe muscle tone, hormones? Do you feel? Did you do any test levels?
Yeah, actually, according to my testing, other than my hair becoming way thicker, which I don't know if I can attribute that to diet or exercise or just the expansion, but hormonally, my testosterone, thyroid hormones, etc., went from being sort of borderline low end, something where I might consider it a problem, but your average doctor might say it wasn't really bad enough to be clinically an issue, to actually becoming clinically on the high end, which is a pretty drastic change.
So what would you like to see, like in the realm of orthodontics as a whole, or I guess just expansion?
Well, I became somewhat infamous online as not only a pretty unprecedented expansion case, but also one of the few, or maybe even the first, proven protraction case due to the headgear I wore as I was expanding.
Right.
No, I got the bow.
Okay, so that's the one that goes on your chest and on your forehead.
Right.
Was that easy to wear at night?
It wasn't horrible. I mean, I'm certainly ways it could have been easier. The ways it might have been easier to wear might have made it harder to take off and put on, but I think it would have been more consistent at night.
Well, wow, man, you're really an anomaly in this expansion era. Like, you are the only one that has gone over however many centimeters. Like, 2 MSCs, you maxed out 2 MSCs. Could you name one person who's maxed out 2 MSCs?
I can't name anyone, but Dr. Newaz said I might be a second biggest case. I don't know who his first is.
Wow. Well, regardless, like the expansion you've got, I can just tell, like in the nasal region, that by the sound of how you breathe, like it's like a fucking mammoth breathing. You sound like a fucking like it's wide. It's wide, and that's no disrespect, because that's the level I think that we're designed to breathe at. Like, I don't think people should really be reliant on having to put foregut posture, craniofacial dystrophy, and having to sacrifice their posture and blood flow to the brain just to be able to breathe. So nasal breathing, like are you more vascular, or like how any physical attributes that you can contribute to MSC? I know it's not entirely because of it, but you know.
Yeah, unfortunately, this isn't really like an experiment with controlled variables because I didn't start seriously exercising until I was already well into the MSCs. But certainly other than the hormonal changes I mentioned earlier and obviously the muscle gain, the breathing, I'd say the only times I really mouth breathe now are when I'm really sick. So
Would you do it again?
absolutely, but if I had to do it again, I hope I could do it now because I know FME is out.
What would you do differently aside from doing FME?
And I would do exactly what I did, but with FME.
So why are you excited for FME? The locking tads?
Yeah, I think that's the main thing, the locking tads and more tads. I mean, I know there's a custom marking now where they can use essentially as many tads as they want, but they're not locking. So the results can really vary depending on the design, the placement. So I like the predictability, and I also like how they're planning on anchoring protraction devices directly to the expander itself. So people should be able to get more protraction and sort of fewer dental ramifications.
Well, with the protraction scene, the market is very limited with the effectiveness of the headgear. If any changes were to occur in protraction, do you have any recommendations? What would you change about the bow, or if you could wear a protracted device during the entire day without it affecting your livelihood of work or whatever? Would you be open to that?
I don't really know of any protraction device that I could have worn through the entire day that wouldn't have gotten in the way of the things I normally do. But I will say I broke the bow multiple times. I had to buy industrial glue from Home Depot to put it back together.
Really?
I also say that the headpiece, even if you anchor it, it tends to slip off your head at night. Especially the more force you apply pulling, the more every reaction has an equal and opposite reaction. It's going to want to come backwards. It's going to want to sort of pop off your head. The straps around your chest are going to want to shift. So some way that you could sort of keep it centered and keep it anchored to the head. It would be nice if there were more bands maybe around the back of the neck to keep them in place.
Do you have any recommendations for anybody that was in your position in 2021? Narrow maxilla, recessed mandible, terrible breathing. Did you suffer with any depression or any sort of mental illness before MSC?
I'm just not sure that's relevant. I had a surgery for all that, so I can't attribute the fact that I breathe better, I fixed that. I mean, certainly changing my life has been an ongoing process, and I'm still working on it right now.
So if someone was in your position 2 years ago, what would you recommend them to do?
I'd recommend that they consult with Dr. Newaz and make a plan.
What would that plan be?
Depends on the case, but probably similar to what I did.
If you could recommend anyone who's in the Discord and Reddit space or whatever, chronically online people, which I think a lot of people who are suffering with the anxiety of not being able to get expansion or suffering with craniofacial dystrophy, could you recommend anything to people who are hyper obsessing over it? Do you recommend being on Reddit, being on Discord? Do you think it makes your mental health worse?
I think that's a hard question. I think there's a lot of misinformation out there. I think there's a lot of deadlifts out there, and people can really fall into that. But I'd say the bright side is that if you can make the right plan, whatever you feel like is wrong with you, there are ways to fix it. There are real treatments for just about everything, but the most important part to the way you can avoid risk is just you need a really good plan and you need really good people on your side. So I know biggest issues are people in other countries, generally impoverished countries. They don't have access to the kind of doctors who do these things, and even if they did, they just simply can't acquire the resources to really travel. So certainly that's one scenario where it's not quite that clear cut, but.
Well, Thank you, bro. I really appreciate you coming here and talking
Sure.
to me and doing this testimony. And I'm really excited to see your journey and documentation and progress and result. So
Yeah, well, I'm active online, so
awesome. Well, I'm
TVP.
excited to see how everything plays out. So
Yeah.
awesome. Well, thank you, bro. I appreciate it.
Yeah.
Thank you for the conversation.
sure.